Hi guys, again, I'm Kat, your RN VAD coordinator. This video, we're going to talk about how to connect your patient from battery power to wall power. Not terrible, okay? Just make sure when your patient is up and ambulating, especially when they're working with PT or they're going to a test, they have to be on battery. You should not be ambulating patients on your wall power. If they have to go to the bathroom in the middle of the night, that's okay, but realistically during the day, they should be on battery, okay? Before you connect to wall power, you want to make sure that these two lights are on. If these two lights are not on or they're yellow, it means this is not plugged in. And when you put your patient there, they're not going to be delivering power to the pump. So make sure that this is plugged into a red outlet on the wall in case there's a blackout, and these two green lights are on. Now, remember I said before, color really doesn't matter with the clips. Here on the wall power is where it matters, okay? So like I said, you could do white to wall, black to battery, so you can disconnect your white cable. Okay, make sure you're twisting towards the unlock side, and I like to spin it so I know I'm totally disengaged, and pull straight out, do not twist it. Same thing as your clip, you're gonna notice a little half moon in there, okay? Half moon on here, half moon opposite half moon makes a whole moon. You are going to push till that gap disappears, straight, don't twist it, and now you're gonna close the lock, okay? Notice that when I hooked the white one up, my numbers came up. So your white one is your data cord. They both give you power. This one gives you data and power, okay? Now, you're just gonna connect the black one. Please remember, never, ever, 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 ever disconnect both power leads at the same time. Yes, your patient has a backup battery, but you don't wanna have to depend on that. Please make sure if you're getting a patient ready for a test, so we'll go back to battery so you guys are comfortable, your patient isn't doing it at the same time as you are, because you will disconnect at the same time, and then it will be a very scary red alarm that says no external power. Your patient's okay because they have the backup battery, but we don't want to use it, okay? So now, if your patient wakes up in the morning, we need to put them to battery. We are going to disconnect from here. Remember, twist towards the unlock picture. Before we put our battery in the clip by red arrow to red arrow. And then you're gonna do half moon, opposite half moon makes a whole moon, and you're gonna click. So it's the same going either way. Okay. Most important thing, guys, is if you ever meet resistance with any of the equipment, please don't jam anything. If you can't get a cable connected, if you can't get a battery in a clip, stop what you're doing and reassess, because something might be broken. So really pay attention to what you're doing. And that is how to change from wall power to battery and vice versa. What are you saying? I don't know what you're doing. Just stop the video flow. What are you talking?